Welcome to the GynaeGuide. We're a group of fifth-year medical students at the University of Edinburgh, tackling some of the big topics in obstetrics and gynecology. Today, we're talking about pain relief in childbirth. Giving birth can be a painful experience, certainly not as straightforward as a stalk delivery. However, there are a number of pain-relieving medicines, known as analgesics, that minimize discomfort during this process. Although not always used all at once, some well-known examples include oral or muscle injections with opioid painkillers, aroma or hypnotherapy, water birthing, and TENS, which uses gentle electrical shocks to interfere with pain signals. In this short talk, we'll cover the facts and bust key myths around two of the most common of these approaches, gas and air and an epidural. Gas and air normally means Entonox, also known as laughing gas, which is delivered through a mask. You can then self-administer this by breathing through the mask as you need. Initially, it may take up to a couple of minutes to become effective. However, as you take more on board, this will reduce to 15 to 20 seconds. This painkiller doesn't stay in your body for long. It doesn't affect your ability to move, and importantly, it doesn't affect your baby. Unfortunately, it can't control everyone's pain, and stronger treatments might be needed. Side effects include lightheadedness, nausea, or drowsiness. It's time for our first myth. It is sometimes thought that gas and air can only be used at the start of labour. Do you think this is true or false? Pause the video, have a think, and unpause when you're ready to find out. The truth is, gas and air can be used in childbirth at any time, or indeed any place, including your own home. However, often in the latter, more painful stages of childbirth, some people need stronger relief, including oral opioid painkillers, which gas and air can be used in combination with. Time for our second question. Do you think that this means gas and air is a weak painkiller? Pause the video, have a think, and when you're ready to find out, unpause the video. The truth is, it's not. Gas and air stimulates your body to produce its own painkillers. In some people, this can be quite powerful, but other people might, at certain points, need an extra top-up. We'll now talk briefly about epidurals, how we feel pain, how they work, and some key questions around whether they might work for you. Like all sensations, pain travels along nerves, first to your back, then up your back in the spinal cord, until it reaches the brain, where you feel it, like this person who stubbed their toe. An epidural is a thin tube placed into your back, through which a numbing agent that blocks the pain signals and an opioid painkiller can be given. This is normally done whilst you're sitting up. Unlike a full spinal block, which might be used in surgery, an epidural doesn't actually go into the spinal cord. However, this means you might need top-ups, which you can have as and when you need. 98% of patients were satisfied with an epidural for control of their labour pains. However, there are some times when an epidural might not be suitable for you. If you want one, your clinician will discuss these scenarios with you. However, important contraindications include, for example, if you have bleeding problems or take blood thinners like warfarin, if you have an infection near where the epidural would go, or you have severe back problems like bad arthritis or previous surgery, or if you've had bad reactions with local anesthetics or painkillers or previous epidurals. There are some serious side effects you should be aware of with an epidural. There's a 1 in 10 chance of the block not working properly, and you needing more painkillers or for it to be tried again. It can also cause low blood pressure, which could make you feel faint. There's a 1 in 100 chance of you experiencing back or headache from your epidural. Very rarely, you might experience drowsiness or temporary nerve problems, like numbness or weakness in your legs. These should resolve over days to weeks, but can last months. Additionally, there's a very small chance that you might experience some more serious side effects, such as death or permanent nerve damage. These risks are incredibly rare. You're actually 3 times more likely to be struck by lightning. Every precaution is taken to prevent them, but it's important that you're aware. You should discuss whether epidural pain relief is for you at your antenatal appointments. This QR code takes you to an information sheet from the Royal College of Anaesthetists, linked in description, which will tell you more about epidurals if you're interested. There are two main questions people often have with epidurals. Firstly, do they interfere with the birth experience? Pause the video, have a think about how they could, and then unpause when you're ready to find out. The decision to undergo an epidural may influence the birthing process in a number of ways. Firstly, they can only be delivered in an obstetrics unit as more observation is required, and this can prevent you from having one at home. Secondly, modern epidurals use a lower dose of drugs, allowing you to feel the height of a contraction and the resultant urge to push. The midwife should aim to preserve this sensation when dosing out your drugs, but as a result, you may not be 100% pain-free. Thirdly, there is no relationship between epidurals and C-sections. Similarly, epidurals, especially with lower doses, do not directly increase the risk of you needing an assisted delivery. This might actually be because epidurals are more commonly used in longer or more painful deliveries, where instruments are independently needed. Finally, the new lighter epidurals now also mean you can move around and walk. However, if more pain relief, known as a full block, is needed, this can make your legs too weak to walk. The second question people often ask is, can epidurals cause back pain or paralysis? Pause the video, have a think, and then unpause when you're ready to find out. Following an epidural, some people can experience pain in their lower back where the tube was inserted. This isn't permanent, but can remain for a few hours or days. There is no evidence showing a link between an epidural and permanent back pain, which is far more likely to result from the stresses pregnancy places on your back and posture. Serious complications, including nerve damage, are extremely rare. Some people experience temporary nerve damage, but permanent damage is even rarer. According to the Royal College of Anaesthetists, approximately 1 in 24 to 50,000 people who receive epidurals may have a lasting numb area or small weakness, whilst severe nerve damage, resulting in paraplegia or death, may occur in 1 in every 55 to 142,000 epidurals. In this video, we've covered how gas and air and epidurals work, their benefits and risks, that gas and air can be used throughout labour and can be quite a potent painkiller, and that epidurals are highly effective but can influence your birth in a number of ways and may rarely cause some lasting harm. Don't forget that there are several other ways you can receive pain relief, including painkillers and TENS nerve stimulation. If you have any questions, we'd recommend you ask your clinician or named midwife. We hope you enjoyed learning with us. Be sure to follow us at the GynaeGuide, and we'll catch you next time. This work was delivered as part of a teaching project by fifth-year medical students at the University of Edinburgh.